Good morning, everyone. My name is Yazmin Escobar, and I will be presenting my PowerPoint on diabetes insipidus. Okay, definition. Central diabetes insipidus, or CDI, is a disease in which a person's kidneys pass abnormal large amounts of urine or polyuria due to vasopressin deficiency. The condition is caused by a hormonal abnormality that is not related to diabetes mellitus. The person is missing the ability to secrete ADH, antidiuretic hormone. So not to get confused with diabetes mellitus, which is the when your blood sugar is too high, and of course it needs to be managed. But I'll talk a little further about that later. And the ADH is the hormone that is secreted by the pituitary. Thank you. Okay, let's just continue here. Central diabetes insipidus is the end result of a number of conditions that affect the hypothalamic neural hypophyseal system. Causes include genomia, craniopharyngioma, Langerhans cell, histosis, local inflammatory autoimmune, or vascular disease. Also, a trauma resulting from surgery or an accident. Sarcoidosis, metatarsus, and midline central and cranial malformations. In rare cases, the underlying cause can be genetic defects in vasopressin synthesis that are inherited as autosomal dominant, autosomal recessive, or X-linked recessive traits. Basically, I just wanted to add a little point. Basically, what I'm trying to put here, based on what I read, it's definitely a damage or a defect caused by the pituitary. Okay. Diabetes insipidus is a rare disease with a non-univocal reported prevalence of 1 out of 25,000. Less than 10% of diabetes insipidus can be attributed to heredity forms. X-linked NDI, nephrogenic diabetes insipidus, represents 90% of cases, or congenital NDI, and occurs with a frequency of 4 to 8 per 1 million male live births. Autosomal NDI accounts for approximately 10% of the remaining cases. Okay, the anatomy. Posterior pituitary produces ABP and or oxytocin, where the hormones are secreted into the bloodstream. The axons of the posterior pituitary store quantities of ABP to sustain basal release for 30 to 50 days to allow antidiuretics for 5 to 10 days. Okay. Physiological of water homeostasis. The maintenance of water balance in healthy humans is achieved principally by 3 interrelated determinants: thirst, ABP, and kidney function. Apoline, a bioactive peptide, acts as a potent diuretic neuropeptide which counteracts ABP actions through inhibition of ABP neuron activity and ABP release. Both ABP and apelin play a role in maintaining body fluids. ABP acts on the kidney where it increases urine osmolarity. An increase in polyuria occurs when more than 80% of the ABP secreting neurons are damaged. Extensive destruction can be caused by a variety of pathological processes, including genetic causes. Autopsy shows a loss of large neurosecretor cells in the hypothalamic nuclei. Also shows a selective loss of magnocellular neurons in a paraventricular nuclei, suggesting that the disorder is due to degeneration of these hypothalamic neurons. Okay, diagnosis. Clinical examination, important clues to underlying diagnosis. Symptoms, polyuria and polydipsia. Young children may have severe dehydration, vomiting, constipation, fever, irregular sleep, disturbance, failure to thrive, and growth retardation. Intracranial tumor is suggested to cause CDI, and autosomal dominant CDI clinical disease onset typically ranges 1 to 6 year, first to 6 years of life. Usually symptoms worsen with age. A deprivation test and desmopressin challenge. Urine volume is recorded within 24 hours. 7 hours of deprivation, basically to investigate electrolyte, plasma osmolarity, urine osmolarity, as well as kidney function. I have an image here of an MRI of the posterior pituitary, basically looking for any damage done by the pituitary, where the hormone is secreted. It's definitely important to diagnose if any damage has been done, just so that we can cancel out any other diseases. Treatment for CDI is desmopressin, which is a synthetic vasopressant, regulating urine as well as the need to drink or thirst. Daily weight is needed. Check fluid balance and monitoring electrolytes. Okay, and pretty much what I have to present. So I did learn a lot. Did not know that there was more than one type of diabetes, but it was very interesting. I didn't realize that just having your pituitary being damaged, it just causes a lot of health issues. Yeah, I definitely enjoyed this activity, and I hope to do another activity soon, and thank you so much.